Well, good evening, everyone. Thank you so much for joining us tonight on a special session of Ask the ARC. My name is Carly Shortino-Poulter, and I'm the director of the ARC Advocacy Network here at the ARC of Indiana. And I'm also a mom. I've got a 25-year-old son with autism who's on the family supports waiver and who receives services. And anytime something comes out from the state, I look at it through both lenses because I'm always a mom and I'm always a mom first. And so I'm always thinking about how does this affect my son and my family? But then as the director of the advocacy network, I'm also thinking, how does this affect people across the state? How does this affect our callers? How does this affect the self-advocates that we talk to and that we work with? And so I can never separate the two. And that happened again a couple of weeks ago, because 2 weeks ago, the state of Indiana published new waiver amendment proposals for the family support, CIH, traumatic brain injury, health and wellness, and pathways for aging waivers. Now, they have published those. They have put them out for public comment, so that people can see what type of changes they want to make, and give their feedback on this. And that's wonderful. I want people to be able to give their public comment. Between the five waivers, that's about 1,800 pages to go through. And it's a lot. And it is not an easy read. So that's why we're having this special session of Ask the ARC, so that tonight we can talk about what those waivers are proposing, what the changes are, and how you can give public comment. We're also going to talk about, why we are in this situation. Why are we considering new changes, especially when new waivers just went into effect on July 1st. It hasn't even been a month. Why is this different? And so that's what we're going to talk about tonight. This webinar is scheduled for 1 hour, but to me, it is even more important that people have the opportunity to ask their questions. So we are going to go as long as we need to make sure that people get the answers that they need. We are recording tonight, so if you can join us and stay with us for the entire session, wonderful. But if you're not able to, or you need to step out, that's okay. We are recording this and we will post this to the Arc of Indiana's YouTube channel as quickly as we can so that you can go back over it. You're also always welcome to talk with our family advocates here at the Arc so that you can ask your specific questions and get some more information that way. What I'm going to ask is, as you have questions, go ahead and put them in the Q&A. I'll stop periodically and share the questions that are being asked and answer those to the best of my ability. Like I said, it's about 1,800 pages of documents, and I do not have a photographic memory. So sometimes I may have to tell you, I don't know the answer off the top of my head. That's where I'd need to look it up. But we're going to answer as many questions as we can. Tonight, as we talk, I'm going to tell you about some things that you may very well like. I'm also going to tell you about some things you may very well not like. That's okay. That's why it's so important that you give your public comment and that you share what you think about these proposals and how this will affect your family. So let's go ahead and get started. Okay. So tonight we're talking about 2025 waiver changes. Here we go again. So why are we actually here? Why are there more changes? Well, first of all, they want to make some administrative changes, especially to try to make the waivers more consistent. Now that 4 out of the 5 waivers are under the Bureau of Disability Services, they want to make things a little more consistent so that it's easier to understand and to avoid any confusion. Part of it is also in response to public outcry, and I'll explain that here shortly. And then, of course, there are also financial reasons for why we're here. And let's start there because that gives you the context of why we're doing this, and it gives some background information on what has led to some of these recommendations and frankly what we are facing moving forward. So as many of you know, back in December of 2023, Indiana announced that we had a nearly $1 billion projected shortfall in Medicaid. That's why we made a lot of those initial changes back in that went into effect July 1st of 2024. We continued to make a few changes that went into effect July 1st of 2025. So literally about 3.5 weeks ago. But in April of 2025, right before the end of the Indiana General Assembly session, Indiana announced that there was a projected $2.4 billion revenue shortfall, meaning that the state of Indiana was projected we were going to take in $2.4 billion less in taxes than we had originally planned. And so that is affecting a lot of the things that they continue to pass through the General Assembly, and that's absolutely having an effect on these proposals right now. There is also a general federal funding cuts that are coming forward. In fact, Indiana is and that's related to that projected revenue shortfall is because some of the general federal funding cuts have a huge impact on Indiana. Indiana is actually the third most reliant state on federal funding, and that's not just programs like Medicaid or food stamps or things along those lines. Here in Indiana, we have a lot of research um, uh, grants. We have a lot of businesses and organizations and universities who do a ton of research, and part of that research is funded by federal grants. That part of that projected revenue shortfall was also due to anticipated tariffs because because Indiana is still a manufacturing state. A lot of our jobs are manufacturing jobs. And so a lot of those manufacturers are anticipating decreased demand for manufactured goods because of the increased costs due to the tariffs. And as a result, the state is anticipating job losses from those potential tariffs. And so that's kind of the background of where we're at and why we got here. Then there are some other anticipated federal cuts. On July 3rd, Congress passed the Big Beautiful Bill, and President Trump signed it into law. That calls for nearly a $1 trillion in cuts in Medicaid over the next 10 years. Many people are expected to lose health care coverage as a result of that. Rural hospitals may also close or reduce the services that they offer. And of course, much of Indiana is rural. And it is anticipated to reduce the state's revenue for the state's Medicaid match. So Medicaid is this interesting program where some of the money comes from the federal government and some of the money comes from the states. Here in Indiana, about 2/3 of the funding for Medicaid comes from the federal government, and about 1/3 comes from state funding. And there is something called a provider tax, which any provider who accepts Medicaid pays a 6% tax back to the state. And that money is used in part to cover Indiana's match for Medicaid. And so that big, beautiful bill also calls for reducing that provider tax from 6% down to 3.5% over the next 10 years. What that means is we have less money for the state to put into Medicaid, and that's also going to affect our Medicaid dollars going forward. And so as a result of that, the state is likely going to focus more on the required services under Medicaid and reduced optional costs because certain parts of Medicaid are required. For example, covering health care for children under 18 who are below the poverty level is a requirement. But home and community-based services, which are the official name for Medicaid waivers, are an optional cost. States don't have to provide waivers, and they get to choose how much they want to spend on these waivers. So if the state has to reduce costs, this Medicaid waivers are one area where they can cut those costs. So that's the environment that we are in right now. And those are the things that we have to know so we can address them, so we can make sure that we are preserving Medicaid and that we are protecting our Medicaid waivers. So in this, in these proposals, some of the things, some of the changes are really more administrative changes. And again, this is for all five of the waivers that we typically think of. So the Family Supports Waiver, the CIH waiver, the Traumatic Brain Injury Waiver, Health and Wellness, and Pathways for Aging Waiver. And part of those administrative changes, when I say that, part of what I mean is they want to make consistency in service definitions across all the waivers because we have certain services that all of the waivers provide, but have slightly different definitions. Like 95% of it matches, but that 5% difference helps lead to a lot of confusion and leads to more mistakes, especially when it comes to the paperwork side of things. So, for example, all of the waivers offer adult day services. The definitions and what's allowed and what's not allowed are just slightly different. So, they want to make them consistent across all the waivers. They also want to create some clarifications so that people aren't duplicating other services that may be available outside of the waivers. So for example, making sure that they are using the Medicaid health coverage for things like mental health services or physical therapy, speech therapy, occupational therapy, rather than trying to tap into the waiver first for those sorts of services. They're also removing some co-licensing requirements for some services in large part to make it easier for new providers to come in. We all know that there's a huge workforce shortage, and so they want to make sure that they can increase the number of providers who are available so that people are actually able to get the services they need. And so sometimes there have been some licensing requirements that have actually interfered with that. So for example, with the service attendant care, which is on the Health and Wellness and the Pathways for Aging and the Traumatic Brain Injury Waiver. In order for a provider to provide attendant care, they also had to be a licensed home health agency. Well, the thing with that is you're not supposed to be doing nursing services while billing for attendant care. So it doesn't necessarily make sense for them to require a license for home health when somebody's providing attendant care. So those are some of the things that they are looking at, is trying to make some of those regulatory matters a little bit easier so that people can actually get the services that they need. One of the biggest things that is changing, and this is a direct result of your efforts of people speaking up and saying what they want and not stopping in all of this, is who can be paid as caregivers. So legally responsible individuals in terms of the waivers only refers to the spouse of a person with a disability or to the parent of a minor child with a disability. And previously, those legally responsible individuals could get paid as caregivers through the aged and disabled waiver. Well, that stopped July 1st of 2024, except they could still provide structured family caregiving. Beginning, if as this proposal is written, starting December 31st of 2025, legally responsible individuals can potentially be paid again under the Traumatic Brain Injury Waiver, the Health and Wellness Waiver, the Pathways for Aging Waiver for attendant care, if they meet the requirements under the extraordinary care definition. They have also added PAC services under the family support waiver. So it can potentially be possible for a legally responsible individual, so a parent of a minor child or the spouse of a person with a disability, to get paid to provide PAC services on the family support waiver. That's the first time that will have happened. Now, in order to be a paid caregiver, though, first of all, it must be in the best interest of the individual. That is always going to be their focus. That is always going to be the first consideration. But in addition to that, the individual must also meet the definition of needing extraordinary care. So it's not going to be as easy as you have a child on the family support waiver. So you as mom are going to get paid to provide PAC services for them so that you can stay home and take care of them. It's not that simple. In order to be eligible to be paid as a legally responsible individual, the person on the waiver has to meet the definition of extraordinary care. And so, first of all, that is caregiving needs beyond the typical age-appropriate caregiving. And specifically, it refers to intensive nursing care needs. And what they mean by that is someone who needs continuous ventilator support, somebody who needs tracheostomy care, someone who needs total parent. I cannot say that word. I screw it up every time. TPN, nutrition supports, and comparable needs. Notice it does not include behavioral needs in this. It is only referring to individuals who have intensive nursing care needs. If that's something that you agree with, or if that's something you think should be altered or changed, that's something that you can put into your own public comment on that. So when it comes to paying those legally responsible individuals, it's specifically going to be for the services of attendant care or participant assistance in care, or PAC services. But those legally responsible individuals can still get paid for structured family caregiving as well. But it's also important to know that in paying those legally responsible individuals, it will be limited to no more than 40 hours per week for all legally responsible individuals combined. Because I know in the past, one of the questions we've had is, hey, can mom get paid for 40 hours a week and then dad get paid for 40 hours a week? Under this new proposal, it would be 40 hours total. So they couldn't each get paid for 40 hours, but combined, they could get paid for 40 hours. Now let's talk about other paid caregivers, because this is also one of those things that's going to change. And in part because the skilled nursing waivers, the traumatic brain injury waiver, what used to be the aged and disabled waiver and is now the health and wellness or the pathways for aging waiver, those waivers, and then the family support and the CIH waivers had different rules on that. And so they're trying to make that more consistent. And so legal guardians of adults and relatives will be limited to no more than 40 hours per week. Wow, that I didn't write that very well. Legal guardians of adults or relatives can be paid for no more than 40 hours per week per paid caregiver per waiver participant. Okay. Now, here's the thing that's changing. They are aligning the definition of relative. And so now, relative is not just going to apply to a parent. Relative is going to apply to parent, sibling, grandparent, child or grandchild, aunt or uncle, niece or nephew, or first cousins. And you need to know that that also applies to natural parents and siblings and grandparents, step parents, siblings, grandparents, nieces, nephews, half siblings, adopted family members, or in-laws. They are all going to be counted in that definition of relative. So your aunt-in-law is going to be one of those individuals who is limited to no more than 40 hours a week of paid caregiving. So I've got a couple of questions that have come in. And again, I want you to go ahead and put your questions in the Q&A so that we can answer them. But I know with that paid caregiver piece, that's one that a lot of people have had questions about and have very strong opinions about. And I want to make sure that you are asking your questions here so that you understand what's going on, so that you can then make sure that you are giving your public comment and what you think should happen. Let's see. What is our option for the cost of the Medicaid waivers? Well, right now, I think one of the biggest things is making sure that that legislators, both at the state and at the federal level, really understand what waivers are. Because believe it or not, they genuinely and generally don't know what Medicaid waivers are, and they don't know what they really do. and they don't know what they mean in people's lives. And so a big part of this is humanizing all of this so that they understand what a waiver is and that Medicaid is actually the program that pays for these services so that people can live their lives and be able to have a good life, be able to have a successful life, and be able to do those things that everybody else gets to take for granted. So that's really one of the most important ways that people can stand up and try to protect waivers and Medicaid funding going forward. Um, so okay. Sorry. I'm realizing that I probably should have worn my glasses, but my glasses don't help very much either at the moment. So seems like we may have some misunderstanding and it could very easily be on my side about whether or not attendant care provider agencies were also required to be home health care or licensed home health agencies as well. So there's a little bit of confusion on that. Um, so somebody's bringing up behavior needs. We're going to get into that here in a few minutes because there are some major changes that they're proposing when it comes to meeting behavior needs. Um, can our case managers through the family support waiver help coach us through these changes if they're approved? Yes, they absolutely can. And that's one of the things that they should be doing is your case manager should be guiding you through all of this. I think this is also something that is, it's these proposals have been out for about 2 weeks now. And so, like I said, it's about 1,800 pages in all. So part of it is making sure that somebody of those agencies is able to get through all of the materials and then get that information to case managers. So I think right now we're still new enough that information is getting down to them. But yes, this is absolutely something that case managers should be able to help guide people through. Um, let's see. It seems like in very small communities, that definition could eliminate almost most available caregivers. That definition of extraordinary care, you're absolutely right. It is definitely very limiting. Um, in order to pay legally responsible individuals, the state of Indiana does have to have a definition of extraordinary care. They actually put that out for public comment about a month and a half, maybe 2 months ago, and we're asking for people's input on that. And again, this may be what they're doing now, but as we've seen with this with the LRI issue, nothing is ever fully done. We don't stop working on these things. We keep working to make sure that people get what they actually need. Would G-tube feeding be included in the definition of extraordinary care? I will say possibly because part of that depends on whether or not the G-tube is stable. It depends on a lot of factors, but there is a decent chance that very well could be part of that. Um, so. Says slide 10, other paid caregivers. What services are allowed? Are the services only the extraordinary care in regards to nursing? So no, and I'm really glad you asked that. So thank you very much. So when I'm talking about other paid caregivers, and there are a lot of different services that relatives in particular can get paid for. I really, in all honesty, I've always got to look at the specific service definition to see if a relative can provide that sort of can be a paid caregiver for that. So things like participant assistance in care, residential habilitation, day habilitation. Um, Workplace assistance. There are a lot of different services that a relative still can be paid for. And that's one of those things where I've always got to look up the specific one, but it does not apply exclusively, when it comes to those other relatives, that does not exclusively apply to that extraordinary care definition, and it does not apply exclusively to PAC or attendant care. It's broader than that. When a child is over 18, can each provide 40 hours per week of care on the CIH waiver? They can, yes, absolutely. And that's something that is relatively common. So, yep. And as we're talking about aligning these definitions of relatives, this has been the definition for a relative for the family support and the CIH waiver for about 15 years now. This is really more of a change for the TBI health and wellness and pathways waivers. We were told that it was possible that if it was possible for two parents to provide services on the CIH waiver, is that still the same with these changes? Yes, it is still possible for two parents to provide services under the CIH waiver. It can be a parent and a sibling. It can be, an aunt and a cousin. So yes, absolutely. And most importantly, it can also be somebody who's completely not related to you. But I know that a lot of times, I know how difficult it is to find staff, and so oftentimes family members will turn to other family members to provide that service. In part because there's a comfort level there, in part because those family members, they are safe, they are going to take care of your loved one, that they're not leaving in 3 months. So I know that that's one of the biggest reasons why relatives are often tapped to be paid caregivers. And so, yes, all of that is possible. Is a legal guardian considered an LRI? You're going to hate my answer to this because I'm going to make it a little more complicated than that. If it is a legal guardian of an adult, no, they are not considered an LRI. Okay, and oftentimes when we're talking about legal guardians, that's what we're talking about. But if it's a legal guardian of a child under 18, in that case, I believe. I have to admit, I would have to look it up to be sure, because now all of a sudden I'm getting conflicting thoughts in my head. But if we're talking about a legal guardian of someone over the age of 18, no, they are not an LRI. Does the need for help with catheters factor into the extraordinary care definition? It does actually, and that was one of the things at the June 17th DARS Advisory Council that was brought up, and so that is a consideration. It's not a guarantee. It's not an all or nothing, but it is something that is considered in whether or not someone is, or whether or not somebody meets that definition of extraordinary care. So let me mark these as answered so that I can find my place the next time. Okay. And so let's keep going. So one of the other things that is going to be changing is eligibility determinations. So July 1st of 2025, so literally about 3.5 weeks ago, the traumatic brain injury, health and wellness, and pathways waiver changed the eligibility tool that they are using to determine whether or not somebody meets the appropriate level of care. And this kind of got brought up with some of my colleagues when we were talking about this, because, you know, when we talk about eligibility, our folks have to be eligible for several different programs, and so they were thinking, wait, does this mean Medicaid eligibility, or does this mean Social Security eligibility? No, this means level of care eligibility. And so beginning July 1st of 2025, the TBI Health and Wellness and Pathways waivers started using something called the Inter RAI suite of tools, specifically for home care, pediatric home care, or early years. And now, when somebody wants to apply for those waivers, or they are going through their initial level of care eligibility determination, they now go through an agency called Maximus for that initial level of care determination. Well, under these new proposals on December 31st of 2025, the family support waiver, the CIH waiver, and supported group living, which is the formal name for group homes, will change their eligibility tool as well. They are also going to use the Inter RAI suite of tools, but they will use the early years, the Child and Youth Mental Health and Developmental Disabilities tool, and the Intellectual Disabilities tool. But beads will make that initial determination, just like they do right now. And case managers will conduct those annual redeterminations, just like they do right now. So it's really for the family support, CIH, and group homes. It's a matter of they're going to be changing the eligibility tool to determine whether or not someone meets the appropriate level of care care for a waiver, and that's going to be go into effect December 31st for those waivers. For the TBI Health and Wellness and Pathways, that has already gone into effect. So now let's talk about new services that are being proposed or that are being um, added to these proposals. First, the state is looking to add benefits counseling to the family support, CIH, TBI, and health and wellness waiver. And really, that kind of aligns more with the Benefit Information Network or BIN counseling that you can get through VR, or that you can get through Indiana Works WIPA or SERS. And so it's really looking more, it's benefits counseling that's really looking at Social Security benefits and how work can impact benefits to help people figure out how they can work if they would like to, and how they can work while having the smallest impact on benefits as possible. Then the state is adding extended services to the health and wellness waiver. I have to admit, I wish they would change that name because that sounds so generic, but extended services is another employment service option that will soon be available under the health and wellness waiver. There really aren't a lot of services under the health and wellness waiver to support individuals if they do want to work. And so they want to make sure that there are some supports available if somebody on the health and wellness waiver would like to try to work. One of the things that is also exciting is that the state is extending self-directed care to the family support and CIH waivers. So self-directed care is where an individual or their legal guardian um, recruits, hires, trains, and maintains their own staff. So instead of going through an agency, you find your own staff, you hire them, you train them, you schedule them, you do all of those things. But instead of an agency getting the reimbursement rate and paying part of that reimbursement rate to the direct support professional, in this situation, the individual that you hire would actually get that entire rate. And so, for example, with respite, I think it's now all of a sudden I can't remember if it's respite or if it's participant assistance and care. One of them has a reimbursement rate of $34.39 an hour. Well, right now, that $34.39 per hour is paid to an agency, and that helps cover, their administrative costs, their insurance costs, their overhead, and then part of that money goes to pay the direct support staff. Well, with self-directed care, that entire $34.39 goes directly to the support staff. Now, if you want to use self-directed care, the person you hire has to go through all of the normal training requirements, and they have to go through all of the background checks. And you work with a company called PPL First. That's the agency that the state of Indiana has contracted with, and they do a lot of the employment supports. So while you're the one who's doing the recruiting and the training and the maintaining of staff, they're the ones who are doing the HR type things. So they're the ones who are doing the payroll paperwork. They're the ones who are actually getting them their checks. They're the ones who are dealing with all the taxes and the workman's comp forms and all of those sorts of things. And PPL First is the agency who has the contract here in Indiana to provide that support. So you're not fully alone in all of this, and you do have them as a resource for you in helping you, maintain that self-directed care, but you really become the employer in that situation. And the idea behind self-directed care is that, if you are able to hire somebody and pay them a higher hourly wage, you may be able to get more consistent staff and find the staff who would work best for you. Now, with that self-directed care, there are some limitations. So, for example, legally responsible individuals, legal guardians, powers of attorney, and healthcare representatives cannot be the paid caregiver. So, if your mom is your power of attorney, you cannot hire mom through self-directed care to be your paid caregiver. Now, all of those people can help the individual waiver client in their efforts to, to hire and, train their staff and all that, but they cannot be the paid caregivers themselves. Now, the self-directed care options are available for attendant care, respite, and home and community assistance on the TBI Health and Wellness and Pathways waivers, and they will be available through PAC services, residential habilitation services, respite, and workplace assistance on the family support and CIH waivers. And this is a brand new option for the family support and CIH waivers. I have a feeling more people will have some questions when it comes to self-directed care, and I want to give you guys a chance to get those questions in. So we're going to keep going and talk about some of those additional changes. So one of the other things they are doing is they are adjusting some services. So for example, through these proposals, there's only going to be one category of adult day services for the traumatic brain injury, health and wellness, and pathways waivers. The TBI waiver will also allow shared staffing for residential habilitation so that people can actually have roommates or housemates to help, quite frankly, to help with everyday living costs so that you can split the cost of rent and your electric bill and all of that, because let's be honest, none of that is cheap. They are also updating the supported employment definition for the traumatic brain injury waiver to make sure that it is more accessible and that people are able to get the supports that they truly need, especially so that they can work if they would like to. And they are combining home modifications and home modification assessment into just one service instead of it being two separate services. There are a couple of services that are going away. And one of them is intensive behavioral intervention. That is a service that will no longer be available as of December 31st, 2025, if the proposals go through as is. Also, the state is no longer going to allow new enrollment in facility-based pre-vocational services. That's the formal name for sheltered workshops. So new people will not be able to enter into sheltered workshops effective December 31st. There are also some service limits that the state is proposing, and this is one that a lot of people have heard of and is getting a lot of attention. One of them is that they want to limit both music therapy and recreation therapy to no more than 6 hours per month. And that is getting a lot of attention. That's getting a lot of feedback from waiver participants and from their families. And so if that is something that really matters to you, make sure that you are giving your public comment on that. And you're talking about how this affects your life and how these services impact your life or your loved one's life. But there are also a lot of changes coming to behavior support services, and this is specifically for the family support and the CIH waiver. First of all, they are redesigning these services, but they want to limit it to no more than 12 hours per month total and only one category of behavioral support services per month. So one of the things the state is doing is right now we have a service called behavior management, okay? And there are a lot of different pieces to that. Well, one of the things they want to do is they want to kind of separate that out a little bit and create 4 different categories. One of those categories is consultation. So if you don't necessarily need active behavior support services, but you still want to be able to call somebody up when you need advice, or somebody is relatively stable, but you just want to have somebody that you can call up, with questions or when something happens, just to kind of get an idea of what to do next. That's where consultation comes in, and they will allow up to 3 hours per month of consultation under this proposal. Then they can also do a functional behavior assessment, and they do those right now all the time. And the functional behavior assessment is they will do that before they create a behavior support plan, and they will do it, as people request it or as they think it's needed. But a functional behavior assessment is where that professional observes the person for a while, and they observe them in different settings. They observe them on different days and different times so that they're getting a good idea of what's going on to figure out what behaviors they are actually having, and more importantly, what is the purpose of the behavior? What are they trying to achieve through that behavior? What is happening that may be triggering that behavior so that they can figure out ways to either prevent the behavior from occurring or to de-escalate the behavior when it happens. And so in teasing out and creating a different category for functional behavior assessments, they will allow up to 20 hours for functional behavior assessments in a 60-day period. Then there's that comprehensive behavior supports, which is what we commonly think of when we think of behavior support services or behavior management services. It's that behavior consultant who's working with that individual on a one-on-one basis, on whatever their behaviors are. And remember, behaviors doesn't have to mean bad behaviors. It means learning a new way to do things. And so, behavior is a form of communication. And when somebody is having a behavior, they're trying to tell us something and they don't necessarily have the words to be able to tell you what's going on. And that's why they're having that behavior. And so one of the things that they are looking at is capping that comprehensive behavior support, that one-on-one work with that behavior consultant to no more than 12 hours per month. Now, the state has said that you can appeal for a temporary set of additional hours. So, like if something different is happening, something unexpected or something like that, and somebody needs some temporary additional support, you can request that from the state. But the state has stressed that that is supposed to be temporary additional hours for behavior supports. And then there's the clinical supervision piece that they want to allow for up to 1 hour per month. And that is clinical supervision is something that is already available, and it's something that a lot of people don't necessarily know happens. But with that clinical supervision, anytime a behavior consultant writes a behavior support plan, there is a clinical supervisor who is going over that behavior support plan just as an extra set of eyes to make sure it's appropriate, to make sure it's got everything that it needs, and to really just have some oversight over that. Right now, they also look at the situation whenever someone is on psychotropic medications, to make sure that those medications are appropriate and that they're at appropriate therapeutic levels. And anytime there is a recommendation for some sort of rights restriction, they will also look at that to make sure that that is appropriate. And so, for example, one of the things that sometimes happens is and this is what we hear from people who call into us, is sometimes maybe somebody is being overprescribed medication, and it is really in essence acting as a chemical restraint. How many of you have heard of people who have been basically drugged into a stupor? Well, that clinical supervisor is the one who will step in and say, no, 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 that is way too much medication for this person. Or maybe we've got a situation where somebody is requesting that someone's rights be restricted for one reason or another. That clinical supervisor is going to look at that situation to see if that's appropriate. So, for example, if we've got, and I'm totally making up these situations, please understand that, if we've got somebody and somebody is saying, oh, they can't go outside after 4 p.m. even if they are supervised and have people with them. Well, why would you want to do that? And so they're going to investigate and figure out why that's being recommended and if that's actually appropriate. But another example of that could be, hey, we've got an individual who has diabetes, and their diabetes is not well managed. It is not well controlled. And so as a result, they've been hospitalized several times. They're in danger of having part of their foot amputated. And so we want to restrict sugar so that we can keep them healthy. Well, that's something that they're going to look at too to make sure, hey, is that appropriate? Well, yeah, it likely is. Now, again, I am not a clinical supervisor. I do not have degrees in psychology or anything like that. So I'm making up those situations. But those are the types of things that clinical supervisors look over when it comes to those behavior support services. And oftentimes, families and self-advocates aren't necessarily interacting with those clinical supervisors because it's more of an oversight role. And it's really meant to be that objective third-party assessment. And so one of the things is the state is looking at limiting that to no more than 1 hour per month. And they're also looking at removing that psychotropic medication oversight, and not necessarily requiring that anymore. So that's something else you need to know. And then again, as they are recommending or as they are proposing these limits, one of the things that they are also proposing is that, not only is it up to a total of 12 hours per month, but also that you can only have services in one of those 4 categories per month. So that's something else people need to know. So at this point, we've got more questions that have come in, and so I want to make sure that we are answering those. And so, okay. How can we provide input to the state to share our concerns? Oh, you're about 2 slides ahead of me. So that is exactly what we're going to talk about next. Um, When Maximus does the assessment for the health and wellness level of care and does not find the person eligible, what happens to that person who still needs assistance? Well, the very first thing I'm going to recommend if that situation has happened, you want to appeal because you always have the right to appeal. And even by just and you need to do this in writing by just sending a letter saying you plan to appeal this, you disagree with their decision and you want to appeal, that preserves your timeline, that preserves your rights, and your waiver can stay in place while you are appealing. Then the next thing I'm going to recommend is that you request a copy of their level of care assessment and you go through it with a fine-tooth comb to see, do you agree with the answers they have actually gotten? Because sometimes there can be some misunderstandings or a miscommunication, and somebody they say, oh, well, you don't meet level of care, and it's really like literally one question that is keeping them from qualifying. So you want to get a copy of that level of care assessment so you can go through it to see if you actually agree with the decisions that they have made. And then I'm also going to say, call and talk to our family advocates. That way we can get involved in your specific situation. We will look at the paperwork with you and work with you on those appeals. But remember, anytime you get a denial, anytime you are told, hey, you're going to lose services or whatever the case may be, you always have the right to appeal. You just have a very short window to do it. So you want to jump on that as quickly as you can. Even if it's just to say, hey, I want the appeal, that's what preserves time so that you can gather all of the documents. You don't have to have it all ready when you put in the appeal request. You get in the request and that buys you time to to gather the documents and to create the appeal packet for you. So absolutely. So for you, I'm also going to recommend, please give us a call here at the ARC and talk to our family advocates, and we will absolutely help you out with that. Okay. Um, will the new level of care evaluations consider autism characteristics beyond intellectual disability? They will. And that's actually one of the when I was reading this, that was my first thought too, is they're just calling it intellectual disability, but it's also for developmental disabilities. And that I think that's going to, cause a little bit of confusion, but you bet they are not supposed to look exclusively at people with intellectual disabilities. And frankly, about 50% of people with autism do not have intellectual disabilities. So you bet they will absolutely look at that, at those developmental disabilities as well. Um, Will someone who has been on the waiver for several years have to have the initial evaluation again now, or will they be grandfathered in? So believe it or not, your case manager actually does that level of care reassessment every single year. It's just that most of the time you don't even know they're doing it. So every year you have to have a new level of care assessment. It's not going to go through the initial level of care assessment again. So like if you're on health and wellness or TBI or pathways, you don't have to go through Maximus anymore again. Your case manager We'll do that level of care assessment. If you're already on the family support and CIH waiver, your case manager will do that level of care assessment. Beads can if they need to, but typically speaking, the case managers do that once you're already on the waiver. And believe it or not, they always have done that. It's just that most people never realized it unless there was a problem. Has there been any discussion about adding behavioral services to the health and wellness waiver? Hmm. I don't know if there have been discussions about that. I think that that would be a great thing to put into public comment. If you think that that is a service that is needed on the health and wellness waiver, absolutely put that in your public comment so that they can consider that. I don't know that they would be able to have that in time for a December 31st start date, but they can absolutely start working on that for the future as well. Now, I do know that behavioral services are available on the traumatic brain injury waiver, but I can also absolutely see where that would be something that would be beneficial for the health and wellness waiver as well. And so one of the things I'm going to recommend is in your public comment, share that idea with them. Um, can you have both self-directed care for your respite and caregivers through PPL first and have legal guardians get paid through the waivers using an agency? Um, there are several parts to that question. Can you and so PPL first is not going to be involved with the actual choosing the staff or hiring the staff or anything like that. They're just doing the more of the HR paperwork for that. Can you have self-directed care for respite and use an agency for respite at the same time? I've got to admit, I don't know that answer off the top of my head. I would have to read back through and figure it out. But if you're asking me, hey, could you use self-directed care for respite and use an agency for workplace assistance, for example, that you absolutely can do. That's not a problem at all. But can you do self-directed care and agency and have an agency for the same service? I don't know. I will have to look into that. And you can always give us a call at the ARC so that we can have that documentation up. It's going to take a bit to find and read, but I genuinely don't know that answer. Okay. Um, who do we tell our feelings about restrictions on music and rec therapy? Again, we're about 2 slides away from that, so I'm absolutely going to give you that information. Um, Do we have any sheltered workshops still in Indiana? We do have a few. If I remember correctly, I think we are down to 11 sheltered workshops here in Indiana. And if you're not sure what a sheltered workshop is, a sheltered workshop is the common name for a facility. So for a specific work site where individuals can be paid less than minimum wage. And so we still have 11 of them operating here in Indiana. They all have transition plans to stop, and they are all at various points in that process. At one point, we had I think at one point we had close to 40 workshops, but we're down to about 11 right now. And they've all got transition plans that they are working toward so that they can move away from that sub minimum wage. And those plans all look radically different depending on the specific workshop and the specific community. And some of them are kind of exciting but people are able to work at least minimum wage so that they're getting that competitive employment. So, so yeah. Is behavior management the same as my son's behavior consultant? It is. It is. A behavior consultant is the individual who provides behavior management services. So behavior management is the service, the behavior consultant is the person who provides it. The 6-hour limit to the two services is really bad. We need to tell the state that this is too low, and that is exactly what you want to put in your public comment. Are behavior supports available on the health and wellness waiver? Somebody asked that earlier. Right now, they are not, but that is something that you can absolutely consider putting in your public comment if you think that they should be available. Um, Many behavior supports need more hours. As many of these individuals need those supports as they act out. They need more hours per week. So that's something that you put in public comment. Um, where does training, respite, and support staff fall under the behavior support hours? That's actually going to fall under the consultation piece of this. So when you do have behavior support services, one of the things that they're supposed to do is they're supposed to create a behavior support plan for an individual, and then they're supposed to train the staff that work with that individual to make sure that everybody's on the same page, everybody knows what's going on, and that that individual is getting the supports they need to be successful, even when that behavior consultant is not there, because it's not exclusively on the behavior consultant to work on those behaviors or to provide those supports, but that's going to fall under that behavior consultation, or that not consultation. It's going to fall under that main behavior support piece of that. Um, so we have another question about paid caregivers. If an eligible caregiver is hired by a company to provide residential and community services, those are, they mean that as two different services. They're hired to provide residential habilitation is the service name, or now it's called day habilitation, which is the service that often takes people out into the community for on the family support and CIH waivers. Um, let's see. Then why would they limit to only working 40 hours per week? As a comparison, would other direct support staff, non-relatives, be limited to the number of hours they work? No, non-relatives are not limited in the number of hours they can work. Now, agencies can limit the number of hours they work because they would have to pay them overtime. But no, non-relatives are not limited to 40 hours a week. Um, let's see. Uh, Let's see. If I find another family member that has needs for their relative, then could I provide, say, my brother 40 hours, then provide their relative 20 hours? In theory, you could. I mean, you would have to look at the specific situations, but yeah, let's say you are providing services for your brother for 40 hours a week, and then you've got a cousin who also needs services. You could provide 20 hours of support for the cousin for 20 hours as well. So yes, you could do that. So if the bill goes through and they limit music therapy to 6 hours, the client has available, wait, sorry about that. I'm trying to read this. If the bill goes through and they limit music. Okay, now I'm understanding the question. And one of the things is, this is not a bill. This is not legislation. This is all administrative rules. So this is not coming from the state legislature. This is not coming from Congress. This is the Family and Social Services Administration, and in particular, the Division of Disability and Rehabilitative Services, who is proposing these changes. So the good thing about that is that an administrative rule is easier to change than legislation. But yeah, it's not actually a bill. And so what they're asking is, if these limits for, say, music therapy go through, um, will the hours that they've been approved for so far not matter? Yeah. So what this means is, if this goes through, starting December 31st, um, a person would not be able to have more than 6 hours of music therapy per month. So right now, let's say they get 10 hours per month. Starting December 31st, they would be limited to no more than six, even if it's already in their plan that they could have more. Now, up until this goes into effect December 31st, they can still have their 10 hours a week. But once this goes into effect, and the effective date is planned to be December 31st, that's when it would be limited to no more than 6 hours per month. And here's the other thing, especially for those individuals on the family support waiver, that family support waiver is capped at $26,482 a year already. And so, you know, how somebody chooses to use that budget is supposed to be up to them. Um, so not really sure, you know, how all of that plays in together. I'm going to say things that are going to get me in trouble if I'm not careful. Um, what Are these limits the same for an Algo 1 or an Algo 5 on the CIH waiver? And if so, what is the rationalization for giving an Algo level? Oh, you have an excellent question. So what he's talking about is when somebody is on the CIH waiver, the state does an assessment called an ICAP, to essentially figure out, how much support does a person need? And they put those results, the results of that assessment through an algorithm, which is where they came up with the name algo level. And a person's algo level can be anywhere from a 0, meaning they have really basic needs, to an algo 6, meaning they have extreme needs. And those algo levels are what set the budget for a CIH waiver. To give you an idea, and I can't swear my numbers are correct because I'm making an estimate here. But an average Algo 2, okay, and an Algo 2 is somebody who has regular needs as a person with a disability. An average Algo 2 budget is going to be somewhere in the $40,000 to $50,000 range. Again, my numbers could be wrong. I'm not a case manager. I don't do that part every day. So that's just, that is my educated guesstimate on that. But the higher your algo level is, the more needs you have. So the higher your budget is to meet those needs. And they're asking, what is the rationalization for giving an algo level if you're going to cap everybody at 12 hours per month for behavior management? And I think that is exactly one of those things that you put in that public comment if you wish to. So because yeah, there's a good argument there to be made, that individuals with higher needs may need more support than just those 12 hours per month. Doesn't the removal of monitoring of psychotropic medications increase the risk for our clients? Yes. Um, the risk of over-medication seems like it will be a bigger issue with behavioral services not passing psych meds through human rights councils and having oversight. That sounds exactly like something you might want to say in public comment. Um, so that is a very, very valid concern, and something that needs to be brought up more. Is there anything in here about when all Prevoke services will end for those that are currently participating? So it is slated to end soon. So one of the requirements that went into effect July 1st of 2024. Sorry, we've had so many of these in such a short amount of time. Trying to keep them all separated is at this point is difficult. And so July 1st, 2024, the plan that was approved at that point said that a person could not be in pre-vocational services for more than 18 months from that point forward. If they are going to stop new enrollments by December 31st of this year, at most it could continue on for another 18 months. I don't think I think most of them have end dates prior to that. They have transition plans in place, and so um I think the latest one I have heard, and again, I don't hear all of them, but one of the latest ones I have heard is that by October of 2026, their workshop will close, or will transition. And it's transition. It's not close because most of the time what they're doing is they are adjusting the work supports and the different things that they are doing in order to make sure that people who are able to that people can enter into competitive employment and still have some supports as they do so. And so one of the things that those workshops have all been doing is trying to make those plans to have the smallest impact on their clients as possible while still making sure that they're meeting their needs. So if you have someone who is in a sheltered workshop, whether it is a loved one, whether it is a client, talk with their workshop about what the transition plan is, because they all have transition plans, and ask them what that's going to look like in general, and then what that's going to look like for the person that you care about. So, so yeah. Um, let's see. With the new behavior management limits and such specifics on categories, has an explanation been given on why for those changes? A lot of it is really trying to contain costs. And the reality is we are in an environment right now where there is a lot of focus on how much these services are costing, and how much the state and the federal government are spending on healthcare costs in general. And so part of what we need to be able to do is explain why these services are so important and what they do. Because a lot of times the people who are making these decisions are often just looking at numbers. And when we're looking exclusively at numbers, um, we lose. When we can humanize all of this, when we can help those who are in charge understand what this means in human terms, what this means in day-to-day life, it changes the conversation and it changes the narrative. And as a result, they're a lot more open to trying to figure out other solutions to try to save money. And so this is one of those things where I think we need to humanize it, and we need to put it in real terms, so that uh, so that we can try to make sure people are able to get the supports and the services they need. I also think that because of the situation we are in, one of the things we've also got to start to consider too is making sure that we are using the things we need, but making sure that we are doing so in a way that is fiscally responsible, that we are being mindful of how we are doing things, and look for ways that we may be able to find new ways of doing things that could help save money, or find some different alternatives or some solutions to help us be fiscally responsible so that we can sustain these programs. Because I'll be honest, as a mom, first and foremost, you know, when my son got his waiver, he was part of that generation that had to wait a decade. And when he got his waiver, it was a game changer. It made a huge difference in his life. Um, at the same time, we don't use his entire family supports waiver, because he doesn't necessarily need the whole thing right now. He's got other supports. He still lives at home, and so we can provide some other supports for him, but he still uses his waiver and it's still important for him. And you know, so part of it is thinking about, what people actually need and making sure they get what they actually need, while also making sure that we're sustaining these programs so that they are still going to be available to us in the future. So, but yeah, I think a lot of people are concerned about the limits, and I think that that is fair. I think that that is something where it does have an impact on people's lives and a direct impact on people's lives. And so it's important that people speak up and share, what these changes would mean, so that they can try to save them. How will behavioral changes take place? Um, Will individuals have the choice during their annual meeting to choose which behavior services they want? They will, and part of that is also because, if somebody doesn't need consultation or they don't need a functional behavior assessment, they don't have to use that. One of the things they were trying to do was trying to break it up a little bit more on a billing perspective to make that process a little bit easier. But no, talking with your team about what these potential changes will mean and how to address them and how to make sure that your loved one is still getting the support they need is essential. And so absolutely talk with your team about all of this to make sure that your loved one is not harmed in any of this and that they're getting what they need. Um, won't Maximus do all health and wellness and TBI level of care assessments, not just the initial? No, actually, case managers and will still be able to do the ongoing level of care assessments as well. I think in Maximus can step in and do the level of care assessments if necessary, but the case managers will still be able to retain the ability to do those as well. That is what my understanding is with all of this. And I know that part of this is it's still a really new situation. And so there's still a lot of uncertainty because this has only been going on for 24 days. But that's my understanding with it is that for established individuals, the case managers will be able to do those ongoing level of care assessments. Is there a service definition for the career exploration and planning service? There absolutely is. And so the problem is it is it is part of the provider manual, and so it is absolutely written in bureaucracy. It looks like English, it's its own language. But if you Google DDRS waiver manual, you will get the waiver manual. And in that waiver manual, it's got a ton of information in it. But one of the things is it lists absolutely every single service that is offered, and it gives a definition of what that service is. It tells you what activities are allowed under that service. It tells you what activities are not allowed under that service. It tells you what the documentation standards are so that you know what the provider has to document and report back to the state. And it also tells you who can provide those services and what the qualifications are for providing those services. But you bet that's actually in the waiver manual. So you can Google DDRS for Division of Disability and Rehabilitative Services, DDRS waiver manual, and that will come up. Um, let's see. Okay. My brother's case manager and case management company would not submit an appeal to the ICAP because we cannot find staff to provide services. In other words, we can't exceed the budget. So is the ICAP being replaced by another system of level of care and another opportunity to file an appeal? Can a client, through their power of attorney, submit an appeal directly without the case manager? Um, so the ICAP is not going away. Is the answer to one of those questions. Um, and so I think that this is something that, in all honesty, there are enough details and enough individual specific information. If you wouldn't mind, I would really like for you to call and talk with our one of our family advocates, either tomorrow or next week, so that we can dig into this and try to get the tailored information specifically for you and for your situation, and try to figure out, what are some of the best ways to proceed, and try to make sure that we're personalizing this particular question, because this is one of those things that is going to be very dependent on the details. And so it's not something I can really generalize, but I'd certainly like to help you with it if we can. Okay. Mhm. Mhm. Okay. Uh, have any of the eligibility criteria changed for the CIH waiver? Um, would an individual who is a paraplegic and nonverbal requiring full day care but without clinical nursing needs continue to qualify for the CIH waiver? Um, so there are a couple of different questions in there. Are the eligibility criteria changing? They are going to change effective, well, sort of. So, and I know that is one of the most annoying things is when I get here and I go into all these gray areas. So in order for a person to qualify for a for the CIH waiver, okay, and we're talking about the level of care piece of that, they have to qualify in 3 out of 6 areas. Those 6 areas are mobility, language, um, self-care, self-direction, learning, and capacity for independent living. Those 6 categories are not changing. The tool they're using to see if you qualify in those 6 categories will be changing December 31st. Now, if an individual is paraplegic and if they are nonverbal, I would firmly expect that they would still qualify under level of care. Okay, so in your specific situation, I don't want you to worry about that at all, because of the things that you are dealing with. Like I said, the categories that they look at, those 6 categories, the mobility, language, self-care, self-direction, learning, and capacity for independent living, those 6 categories are the same and will stay the same because those are actually written in both state and federal law. The tool they will use to determine if you qualify in those is what will be changing. Um, it feels like our comments haven't been heard or listened to in the last 2 years. Is there any reason to believe that this will be different now? You know what? I completely understand why you feel that way. And my goodness, it does feel like a little bit like we've got whiplash because this is happening so often. But I will say our comments have made a difference. The fact that they are now agreeing to start paying legally responsible individuals again is a direct result of all of the public outcry that has happened. The fact that they created career planning and exploration was in part due to the comments that they were getting via public comment from people wanting to make sure that people with disabilities were able to work. So sometimes it's slow. And sometimes we've got to take it in steps. For example, not related to the waiver, but one of the other things in the last year or so is that originally the state wanted to not only cap ABA at no more than 36 months of coverage, they wanted to make that retroactive. Well, we were able to get the retroactive piece stopped. And that was a direct result of those public comments and talking with officials to make them understand all of this. Now, I know there are a lot of people out there who are really upset that it's still capped at 36 months. But what that did was that bought us 36 months to keep making our case that ABA therapy needs to be available for those who wish it, and that you can't put arbitrary time limits or arbitrary age caps on that. So I know it feels like they're not listening. And part of it is because right now it feels like we're under assault from so many different directions, and it feels like everything is up in the air at the moment. And I know a lot of people are anxious about that, and I completely understand. But our comments do matter. It may take some time, but they do make a difference. And in fact, it's the only thing that has. So, you know, this is one of those times where I know a lot of people feel beaten down because I talk to them, and there are times where you know I may feel that way too. But at the same time, and I think that's a reasonable feeling, just because there is so much going on. But what I will say is, when you are feeling like that, take that deep breath. Make sure that you are steeling yourself up and go back out there and keep fighting the fight. And know that you are not alone in any of this. there are lots of us. And as we raise our voice, as more of us raise our voice, as we raise our voice over and over and over again, we're much harder to ignore. And they are paying attention and they are listening. And it may take a little while, and we may have to do things in steps, and we may have to do them in baby steps, but it does make a difference. And it's the only thing that ever has. So, so I understand your feeling, but we're going to keep working on it and we're going to keep moving forward. Um, let's see. I've got a question about Medicaid, and so I'm going to come back to that in a little while. Wait, no, I'm going to go ahead and answer this. I know this presentation is about waivers, but do you know if any changes to Medicaid, and that's Medicaid health insurance, or supervised group living may impact folks with IDD? So yes and no. So a lot of the changes that are that have been passed for Medicaid are more geared toward the Medicaid expansion population, so individuals who are on HIP here in Indiana. Um, will it affect people on waivers? It should not directly, except for the fact that we know that there are a lot of people with intellectual and developmental disabilities who may not be on waivers, or who may not be able to get through the Social Security process and who are on HIP, or they may have caregivers who are on HIP, or they may have direct support staff who are on HIP, and those would be the ones who would be most directly affected. The other thing is that, we're having issues right now with Medicaid, sending out requests for documents that are never getting to people. And so one of the big things that we are recommending is that people set up an online Medicaid benefits portal account so that they can go in each month and check for any notices or correspondence that have been sent, so that they can make sure that they are preserving their Medicaid health coverage, and that in turn protects their waiver. Um, I receive behavior support services. Would these new changes affect me in any way? So I think one of the things, and that's a great question, I think one of the things you need to do is talk to your case manager or talk to your behavior consultant and ask them, how many hours a month am I currently getting in behavior support services? And find out from there. My son, for example, gets 8 hours of services, behavior services per month. So is he going to be affected by this? He is not. One of my friends, her each one of her kids gets about 12 or 13 and a half hours of behavior support services per month. They would be affected by this. So that's going to be a very individualized question. And start by talking, either asking your case manager or asking your behavior consultant, so that you know, what are you currently getting, and then have that conversation. If things need to change, how would we do that? Um, I'm confused on hours. Let me start by saying that is totally reasonable. Right now, everything is kind of confusing. My adult son is on the family support waiver, and he only gets 10 hours a week of respite. How do you get more hours of direct support services? So part of that is going to be the fact that the family support waiver has a total cap of $26,482 per year for services. And part of that is going to be case management services. And so then it's really looking and working with your case manager to figure out what other services are out there and what other supports are out there, so that you can maximize his waiver budget to make sure that he's getting the supports he needs. You know, when he's using respite, what is he using it for? Is there another service that may be able to provide that same support, but maybe do it in a small group setting, which would help his waiver go further? So, for example, if one of the things he and his respite staff are doing is going out to the park, and maybe doing some Pokemon Go or something like that. Okay, sometimes people do that as part of respite. Sometimes they do that as part of PAC services. Sometimes they do that as part of day habilitation services. And so with day habilitation, you can do that individually, But you can also do that in a small group. And when you do things in a small group, it reduces your cost. And as a result, you can get more hours that way. So that's really kind of the one of the ways to look into how you might be able to get some more hours. One of the other things you can look into is whether or not home health may be something that is available to your son. And can that help extend some of the supports he gets as well? But start by having a conversation with your case manager, and when you're having that conversation, think about what are the things you want for your son. What are the things you want him to be able to do? What are the things he wants to be able to do? And let that drive the conversation because there may be some other ways to get him the supports and so that he can do the things he wants to do in life beyond just respite. And then that case manager can help figure out some creative ways to make that happen and see if there could be some more supports available to him. Um, will the hours for music therapy and rec therapy be averaged out for the year? Or will unused units 1 month vanish the next month? That is an excellent question, and I'm really, really glad you asked that. It is my understanding that that is over the course of a year. So you can have up to 72 hours of music therapy or recreation therapy per year. And so if you only I don't know, let's say it's December and December is kind of crazy. You're going here, there, and everywhere else. Maybe you take December off and you use more of those hours in, June when school's out. You know, can you do something like that? You can. Okay. And so, the music therapy and the rec therapy is not use or lose each month. They can roll over. And that's one of the things with services in general. And part of the confusing part as a family member is that different services have different rules on that. So certain services like respite, for example, can roll over month to month. You just have to use them by the end of the year. Okay. Then there are other services that are use or lose that month. There are other services that are use or lose in a quarter. I don't have that list, so I can't tell you which services are which, but those are absolutely questions and conversations you can have with your case manager about all of that so that you can plan more and so that you can make sure you've got the supports when you actually need them. So that is an excellent question. Um, what are the what are the budget limits for the family support and the CIH waivers? So the family support waiver has a budget or a limit of 2,000 or $26,482 per year. And that is the same for everyone who is on the family support waiver. The CIH waiver, a person's budget is based on their need. And so the budgets are going to vary based on the individual. Um, let's see. We've got another question about the behavior supports. All four categories are needed or may be needed in the same month. Perhaps the limits provided in the proposed regulations could be a guideline or a pre-approved amount, and additional hours would just need to be additional approval. I think that is something that sounds like it should go into public comment. So and I hope that came across as me supporting you because that was actually my intent with that is you make a really good point and I think it needs to be shared. So, when do these changes take place and how does this all happen? Um, under this proposal, if it goes through as written, it will go into effect December 31st of 2025. Okay. Um, I have no idea why they made it December 31st, but that is what they made it. And so what happens is the state creates a plan. Sometimes it's a full plan, sometimes it's an amendment, but they have to publish the full plan so that people can see it and they can make public comment. Typically there is 30 days available for public comment. And then after they have gotten those public comments, they do actually read every single one of them. And If they decide to make changes based on that public comment, they will make those changes and they will put out the plan for a second round of public comment. Once they have settled on what they want, they will then submit the plan to the Centers for Medicare and Medicaid Services. That is often called CMS for short, or sometimes people just call it the feds. Okay. They will submit it to CMS. CMS has 90 days to review that plan to see if they will give the state permission to do what they want to do. Because just because the state wants to do it a certain way doesn't mean that the feds will agree with them. You know, it has happened, where the feds have come back and said, no, 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 you can't do it like this. This violates, whatever regulation. So sometimes, the feds can actually push back and say, no, you can't do this. Oftentimes, by the time they have gone through all that, they've made sure that it'll clear those regulatory hurdles. But once they have finished with public comment and they've got their finalized proposal, the state will submit it to CMS. CMS has 90 days to approve it or to send it back to the states for changes. And then if if the feds approve it, it would go into effect December 31st, because that is how this plan is written. Um, we've sat through many of the same BEADS meetings and trainings over the years. They used to preach choice and person-centered. Are the caps on services an indication of that philosophy is changing? Not if you ask them, but I think that is an excellent point to make in public comment. So I agree. Um, Individuals with algo levels of 4, 5, and 6 need more hours to meet their behavioral needs. I think that is an excellent point to add to public comment. Um, let's see. Okay. Sorry, guys. I'm trying to read this question. Um, Economic analysis question on music and rec therapies and limiting hours. Does this proposed regulation have any proposed fee reductions? Um, n- at this point, it does not. So waiver budgets are not slated to change at this time. Waiver rates are not slated to change at this time. Can I guarantee that will not happen in the future? I cannot, especially in our current economic environment. But right now, there are no proposed fee reductions. Is there an economic option analysis of the bill available? Um, I will say that in the plans themselves, it does look at it does look at costs. It does look at cost for individual services. It looks at average cost, and in particular in comparison to providing these services in an institutional setting, because that's something that they have to look at. Um, Let's see. So for example, if the approved hours or unit fee was reduced for these services, could the state save a similar amount of money or increase the number of hours per individual? They could. And that is something you could certainly share in public comment. I think one of the other things to consider with that too is, if you reduce those rates, how much will it reduce the workforce? So I'm just throwing that out there, but that's absolutely something that you can suggest in public comment. More importantly, is there an economic analysis or human cost analysis available for each proposed change? There is some economic data in each one of the waiver proposals. It is buried in there. So one of the things you may actually want to consider is looking at the plans that are being proposed, so that you can see if you can find the economic data that you're looking for. Um, I am guessing that type of information exists. Um, where to find it outside of the waiver amendments, I don't know for certain. And so that is something you might even be able to call the DDRS central office or the main state office and ask if that information is available. Let's see. Oh, we have lots more questions. Guys, I'm going to pause the questions for a moment because I know that we are getting, well, wow, we're way past already. But what I want to do is I want to, because one of the things people have asked about is, how do we make public comment? I want to make sure that we are sharing that information, and I will come back to your questions. And so one of the things with public comment is that public comment must be submitted by 4:30 p.m. on August 8th. Tribal comments, and when we say tribal comments, we do mean Native American tribes, must be submitted by 4:30 on August 30th. So they do get a little bit more time, and that's based on all sorts of treaties and things like that. For the family supports, CIH, TBI, and health and wellness waivers, those are the four waivers that are administered by the Bureau of Disability Services. The easiest way to submit your public comment is to email DDRS waiver notice comment at fssa.in.gov. And you want to make sure you put the waiver type in the subject line. So if you are providing comment on the family supports waiver, you want to put family supports waiver comments in that subject line. You can also, if you don't have access to email, although you're all on a virtual webinar, but if you would prefer to mail it in, you can actually mail it in. And again, you put the waiver type. So like family support waiver amendment public comment, care of the Division of Disability and Rehabilitative Services, 402 West Washington Street, number W453, P.O. Box 7083, MS26. Believe it or not, that in theory will help you find the room in the government center. Indianapolis, Indiana 46207 -7083. That information can actually be found on our website on our waiver changes page. So you do not have to rush to write that down. We will have that address on our website because that's kind of long. But here's the thing, let's talk about effective public comment. Because one of the things we saw back in early 2024 is that people were angry. And frankly, they had every right to be angry. And so they were bombarding the state with public comment. Ultimately, it has had an effect, by the way, just pointing that part out. But one of the things with public comment is you want to keep it concise. If you're writing a few paragraphs, if you're writing a page, they're going to read that. If you write 20 pages, they're skimming that. Okay. So you want to keep it concise. You want to say what you want. You want to say what you like about their proposals, if there is something you like. Because let's be honest, anytime you can compliment people or butter them up, they're going to listen a little bit more to the next part. And so if there's something you like in any of these plans, go ahead and share that with them. Thank them for their efforts with that. And then if there are things that you have concerns about or things you think should change, you want to say that too. You want to share your story, share your why. Why is this important? Why is it important to make sure people have more access to behavior support services? Why is music therapy important? Why is recreation therapy important? And then also, what will these changes mean in your life or in your loved one's life? Humanize it, make it matter, and offer solutions. Anytime you can offer a solution, it helps, because when all you're doing is sitting there complaining, sometimes you get tuned out. But if you come to them and you say, hey, I'm concerned that you are limiting these services, and here's some ways I think we can make sure people still have the services they need and that they want, while making sure that we're being fiscally responsible in the process. So say what you like, say what you want, share your why, and offer solutions, and get others to submit their public comment too, because there is strength in numbers. Now, as I say that, one of the things we learned in early 2024 is that sometimes we got some feedback from families that their emails were getting blocked. Well, it turns out that they were sending so many emails disagreeing with what was being proposed, that the state servers thought they were spam. And so that's why they got shut down. So be a little careful about that. Don't send 50 emails. But make sure that as you're providing your public comment, that you're being concise, that you're saying what you like, that you say what you want, that you share your why, and that you're offering solutions. So now I'm going to go back to our questions. Um, let's see. Um, let's see. Okay. Um, How do beads, DARS, and FSSA all fit together? And what makes each of these different? Oh my gosh, we swim in alphabet soup, don't we? We have all these letters and all these agencies, and nobody really knows what they do, and so it's confusing, and you're not wrong for being confused by that. So let's start with the Family and Social Services Administration. That's what FSSA stands for. It is the umbrella agency that oversees about 10 or 12 different agencies underneath them. So the Division of Mental Health and Addiction is under FSSA. Um, the Division of Family Resources, which is what we commonly think of as the Medicaid office, falls under FSSA. The Office of Medicaid Policy and Planning, which is the most powerful agency no one has ever heard of, falls under FSSA, as does the Division of Disability and Rehabilitative Services. Underneath the Division of Disability and Rehabilitative Services, we've got a few agencies. So that's where First Steps, or they oversee First Steps. They oversee the Bureau of Rehabilitation Services, which oversees vocational rehabilitation services. DDRS also oversees the Bureau of Disability Services, which is then what administers four out of the five waivers. So FSSA is the umbrella, then comes DDRS, then comes beads. So I think we need to make a chart so that people can actually understand this a little bit. That's one of the things we are working on right now. Um, let's see. Question on self-directed care and 6 categories required by law mentioned before. Where can I get more information to understand how these categories work and are involved in the waivers? So I think we've got 2 different questions here. One is about self-directed care. And so we actually have a webinar from early 2024 on self-directed care, if I remember correctly. Oh, maybe we don't. No, I take that back. We don't have a webinar on that. But you can Google PPL first, and that's the word first spelled out. You can also go to the DDRS website or the BEADS website to get more information on self-directed care and how that works. Especially because that is something new, especially to the family support and the CIH waivers. As for the 6 categories, what that is referring to is that is actually how a developmental disability is defined. And in both federal and state law, that what that refers to is that in order to be eligible for services, you have to have substantial limitations in 3 out of those 6 categories. And those 6 categories are the definitions of developmental disability. Um, and so again, for more information on that, you can always call us up here at the ARC and we can discuss that a little more, because I have a feeling you'll have some follow-up questions with all that, and that way we can discuss it a whole lot more. Um, Do we tell our story on the waiver comments or just to the legislature? I'm going to say both. And part of the issue too is that right now there are so many different things going on and so many people wanting you to share their story, to share your story. It's getting a little bit confusing. And so one of the things I will say is absolutely, share your story in public comment, but I would also share your story with your legislators, both your state and federal legislators, so they understand what is really going on and understand how this will affect your lives, and reminding them you are one of their constituents and this has an everyday impact on you and your family. Um, is this a complete list of changes to behavior management? I've heard of other changes that were not included so far in this session. If there are, where can we find an exhaustive list? Um, I've read the manual, but it made no mention of B-Man change details. It's because you're looking in the manual, not the proposed amendment, because the proposed amendment is where you will find all of that. And so if you can email me at Carly, it's Karly at ARCIND, short for Arc of Indiana.org. If you can email me, I can get you that, and I can see if I can get you in contact with some people who can give you some more information as well. Okay. Um, who makes changes to supported group living sites and increases those standards of care? Well, that's a twofold question, because in part it's the Bureau of Disability Services, and believe it or not, in part it is also the Indiana Department of Health, because supported group living or group home settings, like formal group home settings, are actually considered institutional settings. And even though the Bureau of Disability Services is the placement authority, the Department of Health is actually the one who regulates them. So it's a combination of both of them. Um, okay, let's see. Okay. Hmm. So apparently we've got some confusion over who is supposed to do the annual redeterminations for those skilled nursing waivers, so health and wellness pathways and TBI. And so one of the things I'm going to recommend is if you Google INLCAR. That will take you to the Indiana level of care assessment review site, and that will give us some more information, because apparently we've got a lot of confusion over who's going to do those annual assessments, hmm, and I'm wondering if, again, so much has been changing and changing so rapidly. I know Maximus was doing the initial ones. It was my understanding that maybe they were going to be helping with the initial, or with redeterminations as they use the new assessment tool. But it was my understanding that case management companies would still also potentially be playing a part, and maybe that's part of the confusion. I will be perfectly honest, this could very well be my misunderstanding on this, and it's something I will look up to have a better understanding on. So you can always call us back, and we can talk about it a little more too. Um, have they ever increased the family support waiver budget without increasing the service rates? Even though over the years the budget has increased, it was never providing individuals with more services. Um, since the family support waiver was created, have they ever increased the budget without being a result of a rate increase? No, I think every time that they have increased the budget for services, it has been because they increased reimbursement rates, and they were increasing the total budgets so that people wouldn't lose services. But no, I think you're right. I think they have only ever increased the budgets to go along with rate increases. Um, Somebody is asking, it is my understanding that on pathways, services are use or lose each month. Do you know if this is the case? I don't know for sure. And with pathways, I also don't know if there's a difference between the managed care entities and whether or not they would be consistent, or whether or not it would vary based on managed care entity. I genuinely don't know that answer. Um, So is this just the first round of public comment? There will be more rounds after this current one. This is the first round of public comment. Yes. Will there be another round of public comment? That's one of the things I was discussing with my colleagues earlier today. And the reason I asked is when the state submitted proposals back in January of this year. I think it was January. We only had one public comment period. They never put it out for a second public comment. And so I don't know if that's because they didn't make any changes at that time. And if they make changes is when there's a second public comment. That's what I was trying to clarify with a couple of my colleagues today. And the one who could answer it was out of the office. So I don't know that for certain. Okay. But one of the things I do know for certain is that we will always keep you up to date on all of that. So, you can always make sure that you sign up for our e-newsletter, you sign up for our legislative memo, just to keep you up to date on what's going on, because we will always make sure that you have the most accurate and most up-to-date information possible. And that's really kind of the best way to do that. Um, Got a lot of people encouraging everybody to share their public comment because it is really, really important. Um, Recently, my daughter was diagnosed with a traumatic brain injury. She currently has the family support waiver. Can she change to a TBI waiver, and or would that be more beneficial for her? You know what? That's a great question to ask. And anytime we have someone who may be eligible for a couple of different waivers, one of the things that I always recommend is that you stop to look at what are the supports your loved one needs. Are your loved one's needs more medical in nature, or are you looking more to make sure your loved one is able to get out and do more things? Because a lot of times when we're having this conversation, it's, should they be on the family support waiver, or should they be on the health and wellness waiver? Or in this case, should they be on the traumatic brain injury waiver? So one of the things I would recommend is, first of all, make a list of what are her actual needs, and then what are the things you want for her, and then what are the things she wants for herself, and then figure out which waiver whether it's the traumatic brain injury waiver or whether it's the family support waiver, which one of those waivers actually gives her the services that will help her achieve what she wants in life, and let that be your driving factor in that. So um somebody said, I got here late. Will the recording be available? You betcha it will. We are recording this, and we are going to be posting it to our YouTube channel, the Arc of Indiana's YouTube channel, as soon as we can. I'm crossing my fingers and hoping we can get that done tomorrow. I can't guarantee we will get that done tomorrow, but we will get it done as quickly as we can. Um, let's see. And Um, in past public comment, we could see the public comment the ARC submitted for each waiver. Where can we find your official comments this go round? We haven't written them yet. But once we do write our public comments, and please understand, the sole reason we haven't written our public comments yet is it's 1,800 pages. And so while for this waiver, we were keeping things fairly general, giving as many details as we can, but still, at a higher level with those public comments to be ready for those. We really do go through it with a fine-tooth comb, and it's literally, comparing the proposal to the current, to the current manual right now, and seeing what changes there really are. So it's a lot more involved, and we just haven't, we don't have them finished yet. When we do submit our public comment, we will absolutely publish those, because we want people to know what our position is and what we have said to the state as well. So we'll absolutely put those out. So, all right, ladies and gentlemen, that seems to be our last question. I know that we have gone quite a while. It's almost 8 o'clock. First of all, thank you. Thank you for joining us. Thank you for asking your questions. You guys had amazing questions, and I greatly appreciate you asking them. I appreciate you coming together, because when we come together like this, and I know that may sound a little bit strange, because we're still doing this virtually. This is still, over a computer, but at the same time, when we are sharing our thoughts, when we are sharing our questions, you know, that's us coming together as a community. And it's helping each other out. It's helping us think of things we may not have thought of. It's getting us to ask questions we may not have considered. And so I want to thank you for that, because I think that that helps all of us. I also want to say thank you for your questions, because they were incredible questions. I want to thank you for your engagement, and I want to thank you for taking this so seriously. And I know, I recognize some of the names on the questions that came through. So I know we have a big mix of parents and professionals and self-advocates. And I am grateful that everybody has come together. And I'm grateful that you are also encouraging to one another, especially about making sure you're submitting public comment, and making sure that you are raising your voice, because it matters. It may take a while, and that's kind of one of the frustrating things, is that it can take a while to make change, but it happens. And it can take a while to improve things, but we can't give up, because that's the only thing that has ever led to improvement, is people raising their voices, people sharing their stories, and people insisting that we can make life better, and we can come together to do that. So thank you so much for your time tonight. If you have more questions, if you think of something later, or if you want to talk through your specific situation, by all means, give us a call here at the Arc of Indiana. Talk with one of our family advocates. We will gladly discuss your specific situation, and help come up with some ideas, and some solutions. Um, I want to make sure that you are staying informed. So you see a little QR code there. That is a QR code tree. Is how they have said it to me, and that way you can sign up for different uh, different information from us. I promise we will not spam you. We will not, flood your inbox. We're going to share the information that is actually important and necessary, to make sure that you're getting the information that you need. Um, Looks like maybe we have had, if I'm looking to see, we may have had another question come in. Um, so nope, I do not. Ladies and gentlemen, thank you so much for joining us tonight. Remember, share your public comment, share your story. Make sure that you're standing up and saying what you want to happen for people with disabilities. Thank you so much, and have a wonderful evening. Good night.